how to treat coronavirus, COVID-19, and increase your chances of survival. I'm going to take you through all of these, explain why they're important, and also you should know that these treatments can be done at home on your own for the most part, some requiring prescriptions from a physician, and I'll take you through that as we go along. So why listen to me? I'm Dr. Bradshaw, a physician, surgeon, and lawyer. Before becoming a trial lawyer, I was a successful physician. As this old letter of recommendation shows, I worked on some complicated infectious disease cases and was considered by medical specialists to be in the top 25% of physicians. And I scored in the top 2 to 3% on some major tests, so I know a little bit. First of all, let's go through the big three. The big three are the easiest but often overlooked and not really followed, but they are critical, and I think it's important for you to know why the big three are critical. So let's go through those one at a time. Number one, hydration. Hydration. Stay well hydrated. This can be water, it could be orange juice, it could be lemonade, it could be tea. Some people prefer tea because it has a little bit of, some of them have a little bit of theophylline in them, which opens up the bronchioles and helps you breathe a little bit better if you have something like coronavirus or any kind of flu, actually. Personally, I think orange juice, fresh squeezed, is better because of the vitamin C and the other minerals and things like that. But it's real important to stay hydrated. Now, why is this important? I think it's important that you know. So coronavirus, also called COVID-19, frequently, not universally, but very frequently leads to bilateral pneumonia. And that's one of the reasons it's worse than some of these other upper respiratory or URI, upper respiratory infections and flus. Because when you get a bilateral pneumonia, while some people get better and they overcome this, some people don't, and it gets worse and worse, and that's when it gets into the real severe illness for a lot of people. So hydration helps you clear this junk out of your lungs as it's forming. And an analogy will sometimes help. Think about it this way. If you have a nose full of snot and you're trying to get it out, you know if it's runny, you can blow your nose and that snot comes right on out, doesn't it? No problem. But if it gets gunky and thick and viscous, you know, you're just like, oh, it's in my sinuses, I can't get it out, I got a sinus ache, you get a sinus infection, you know, it gets gunky and you can't get rid of it. So when it's runny, it comes out better. Same with coughing stuff up. When it's more liquidy, looser, sometimes people will say looser, it will come out easier. So by staying hydrated, you help your body get this stuff more liquidy and cough it up and get it out better. Now, I'm not saying you want to get fluid overloaded or anything like that, but you need to stay well hydrated, plenty of fluids. The next one of the big three is rest. You want to get plenty of rest. Your body needs rest to overcome this, especially if you're one of those people who is older and this may start getting worse. And you think about it too, rest is when the body manufactures and makes things that help fight infections, such as white blood cells, you know, other types of immune warriors within your system that help fight these infections and help repair your body. Often occurs during sleep. So you need to get plenty of sleep, plenty of rest. So be sure and get plenty of rest, preferably at least 8 hours. The next thing that would be real important of the big three, we've talked about hydration, rest, nutrition. Nutrition is critical also. Lots of protein in particular. Whether you're a vegetarian, a meat eater, a vegan, whatever, you need lots of protein because a lot of these immune warriors, these white cells and other things that are used to fight off COVID-19 or coronavirus, are built, they have building blocks that are proteins. So you need plenty of nutrition. Now, along these same lines, you hear some people talk about when you have the flu or you have coronavirus, eat chicken noodle soup. And people are like, what are you talking about? That's just silly. Well, no, it's actually a pretty good idea because think about it. The chicken, of course, is giving you protein and more importantly, not more importantly, but as importantly, you're getting fluids because soup has a lot of liquid in it. So it's really two birds, one stone type of thing. You get the protein, you get the nutrition, but you also get fluids through eating soups. So soups can be good for you. So big three: hydration, rest, nutrition. Now that we've talked about the big three, let's move on to more in-depth medicine. Before we do that, though, I want to make one other point that's really critical for understanding why all this is so important. Remember, 80% or so of the people are going to get better no matter what. You know, the basic three are going to help them get better. And in fact, some people that are younger, really good immune systems, are probably going to get better even if they don't take good care of themselves. But you don't want to chance that, of course. But 20% of the people are going to get really sick. 20% or so are going to get, you know, really bad disease and are going to be really ill, and some of them are going to die. And so you don't want to get into that really sick group if you can avoid it. And if you do start to get into that, you want to get out of it as soon as possible. Think about it like this. The COVID-19 or coronavirus is causing pneumonia in a lot of people. And most people, as this pneumonia develops, especially younger, more healthy people, they're going to fight this off and it's going to go away. But you get people who are older, especially if they have comorbidities like emphysema, lung disease, heart disease, diabetes, things like that, this pneumonia is going to get worse and worse and worse, and it's going to reach a tipping point. And this tipping point is what's critical, because when you start to reach this tipping point, you want this to get better. But instead, you reach this tipping point and it goes worse. This pneumonia starts taking over and it starts getting worse. And then the person starts going downhill. And that's what you're trying to avoid. You don't want to reach that tipping point. If you can avoid it, you want to start getting better before you get there. And if you reach that tipping point, you certainly don't want to go beyond the tipping point to the other side, where now you're in deep trouble. So a lot of this is hopefully to help keep you from getting into that bad situation where you might end up hospitalized or even on a ventilator or something. So that's what we're talking about, trying to resolve the problems before they reach the tipping point, and if they get to the tipping point, try to get them back to where you don't get into that really, really sick, horrible condition where you end up hospitalized, possibly on a ventilator. And it's really important too, because coronavirus is worse not only because of the pneumonia it's causing, but also because of the fact that there's a higher death rate. You know, some people say it's 10 to 30 times more deadly than the typical influenza or flus. I'm not sure on those numbers. That's something you hear. I don't know but we know for sure it's more deadly. No doubt about that. But as an aside, please remember, most people are going to get better with no intervention, just rest, fluids, and nutrition. For the vast majority of patients, it's a URI or upper respiratory infection, fever, chills, runny nose, body aches, and a dry cough, a non-productive cough, that will all go away. The problem is, for a small but significant percentage of people, this URI progresses to a lower respiratory infection also that involves all of your lungs. The lungs develop edema or swelling of the lung tissues, which steroids may help with, and we'll talk about steroids in a few minutes. And with the swelling, the lung tubes and air sacs begin getting tighter. The patient starts having difficulty with air movement, and then an exudate or a junky fluid can start building up in the alveoli or air sacs, which the Mucinex may help with, which we'll talk about in just a minute also. And from there, if the disease progresses, things can get really bad. But there are treatments, both at home from your doctor's recommendations and, if needed, at the hospital. So let's go back to treatment, starting with Mucinex. Mucinex. Mucinex is something that, in fact, here's a picture of it, what it looks like. Now pushing towards patients to help them out. Mucinex will help clear the secretions or thin the secretions, make them more liquidy, so you can cough them up and get rid of them. Take Mucinex with a full glass of liquid water, something like that. Unlike other drugs where they say take it with a glass of water and you're like, whatever, who cares? Mucinex, for it to work best, you really need to take it with a large glass of water or liquids, orange juice, tea, whatever. But you need to do that to make it work effectively. Mucinex, I personally think it works well, helps clear those secretions, helps them get out. Speaking of that, we're talking about that too, cough syrup. Some people say, I cough a lot, I want a cough syrup. Well, when you're trying to clear these secretions, you need to cough and cough this junk out, right? Some doctors will say, okay, we'll give you some cough syrup if you need it at night to sleep, because again, rest is important, right? So you might need a little bit of cough syrup at night, but you don't typically want to be suppressing your cough unless it's just really violent coughing. You don't want to be suppressing it during the day. Again, that would be more your physician's choice depending on your individual status. Always rely on what your physician and the healthcare providers say. The next of the big ones is Tylenol and Ibuprofen. Tylenol and Ibuprofen will drop your fever down. It will also make you feel better. It's an important drug, but it can cause a false sense of security if you're on a high dose, say, of Tylenol, and Tylenol can be toxic if you take too much of it, so always follow the directions on that as well. But Tylenol or ibuprofen can reduce your temperature, and if you go in to see your doctor and you're saying, I feel terrible, I've got this really bad flu, but your temperature is normal, be sure and let your doctor know if you're on Tylenol or ibuprofen, because sometimes that'll drop your temperature down to a normal range when it otherwise would be way up there, and it will make you look better than you actually are. The next thing I say is get a pulse oximeter. Here's what a pulse oximeter is, what it looks like, and it should be up around 97, 96, 98 when you're healthy and you're normal. You get the flu, it's going to probably drop a little bit, but it shouldn't be getting down into the, if it starts getting down into the low 90s, you might be starting to get into trouble. If it gets into the high 80s, you need to be seen by a physician. In fact, most physicians will, in the past anyway, would say that if you're in the high 80s, you probably need to be hospitalized, especially if it's desatting, meaning it's high 80s and dropping down even lower some. Also, in a pulse oximeter, you can tell how bad you are as well sometimes by having that on, and if you get up and start walking around. If you get up and start walking around, typically you'll increase your breathing, you'll take deeper breaths, and that will be important for seeing that your oxygen saturation stays okay, maybe even goes up a touch. But if you get up and start walking around and your oxygen saturation actually begins dropping, the number goes lower, that's a sign maybe you're even worse than what you think you are. So again, the pulse oximeter can be your best friend as far as helping you know where you are. Are you getting worse? Are you getting better? Are you staying the same? You certainly don't want to see it getting into the 80s. If it gets into the high 80s, could be in trouble, need hospitalization. If it drops much lower than that, you need medical care right away. So if you can afford it, get yourself a pulse oximeter. Let's talk then next about another big one, which is steroid inhaler. A steroid inhaler is like one of those puffers, and that will help open up your airways. The steroids will decrease the inflammation, allow the airways to open up a little bit, and help you clear again some of those secretions. Personally, I recommend you get the type that is not the aerosol powder. I've tried the powder, I've had pneumonias before, and the powders I think can be an irritant in and of themselves. Maybe better than nothing, but in my case, I didn't think it helped me very much. I don't know what it'll do for you, but there are some steroid inhalers that are non-powder. I think those are better if your physician is in agreement. Now, we talked about the steroid inhaler, but oral steroids are a little more potent because it hits your whole lungs, everything, not just what's breathed in, but all of the tissue. And oral steroids help decrease the edema and the swelling that occurs in the more severe cases that can become a real significant problem. Now, that's something, of course, you can't get on your own. It has to be a physician that prescribes it, either in an outpatient setting or they'll use them often in the hospital as well. And part of the problem with the virus is that it causes the tissue, the bronchioles, the tubes to start swelling some, and you can even get swelling of the air sacs, which then compromises the airflow both in and out, and it creates an environment that then allows some exudate or pneumonia to start developing and developing more severely if the swelling and edema is bad. So these steroids will decrease the swelling and will help restore that ability to exchange and breathe air in and out, and help also with clearing the exudate if you have a more severe case that you start developing this type of exudate. Now, this is also when they'll sometimes put on antibiotics to prevent or treat a secondary infection. But again, steroids, oral steroids, are often used if it starts becoming a more severe case, and actually they'll use IV steroids typically in the hospital if a person gets admitted. The next big one in the medical aspect of treatment, which I think is one of the best, is a nebulizer with albuterol. Now, that's one of those machines, and here's a picture of that. You can your physician can prescribe. These are sometimes done in the hospital, but they can also be done at home in certain situations. These nebulizers get this albuterol, and there's other drugs besides albuterol, but it's one of the most established one, the gold standard, if you will. And this really helps open up your airways. The albuterol goes in a little reservoir, and then it's nebulized, and you breathe it in. It increases your, expands your airways, opens them up, and allows you to help get some of this junk out of your lungs, and also helps improve your oxygenation. The key behind this, again, is getting better oxygenation, clearing this junk out of your airways. Now let's talk for just a minute about the airways themselves. You have the lungs, which the main tube, the trachea, comes down, of course, and you have your right and left mainstem bronchus, and these tubes get smaller and smaller and smaller into bronchioles, the smaller tubes, which then lead to the alveoli. It's almost like an upside-down tree, with the alveoli being the leaves. And these leaves, or these alveoli, which kind of look like grape sacs, are where the actual air exchange occurs. And the problem with coronavirus is it often causes pneumonia. And this pneumonia can get worse and worse and worse. And it starts clogging up this gunk that develops, which is just cellular debris and fluid. It's this exudate, they call it, starts clogging up not only the bronchioles, but also eventually the alveoli. And that then interferes with the exchange of oxygen. So you can't get oxygen into your system. And that's where the problem really, really develops. So you want to clear this stuff out of there, get it out of there. So that's what we've been trying to do. That's what we're talking about. And again, oral steroids will sometimes help decrease inflammation and allow you to cough all this stuff up. Now, here's a real important point, and here's where a lot of people are dying. They're not able to clear this out sufficiently. The viral pneumonia gets worse and worse and worse. You get what's called whiteout, or consolidation, meaning there's so much gunk in your lungs you just can't do the oxygen exchange anymore, and you eventually die from this consolidation, this whiteout, or adult respiratory distress syndrome. ARDS is the other name for it. Now, sometimes you get better from that, but once it gets into ARDS, or this consolidated bilateral pneumonia with whiteout, it's bad news. Those are the people that are on the ventilators. So this can be from a virus, right? Viral pneumonia. The problem is, and where the big debate sometimes comes in, is the viral pneumonia can convert to a secondary bacterial pneumonia. So you've went from having a viral pneumonia now to having a bacterial pneumonia, and it's like, my gosh, when do you put people on antibiotics? Because physicians are worried about overuse of antibiotics. The problem is, if somebody gets a secondary bacterial infection and they're not placed on antibiotics, they're going to die. So there's a real issue on, do you use antibiotics and when? I'm not going to get into that argument or that debate, but it's something, if you've got somebody in your family, you or somebody who's getting worse and worse and worse, and they're not on antibiotics, you need to be having that discussion with your physician, because has the patient went from a viral pneumonia to a secondary bacterial pneumonia. So these are all the major things then that could be used and are sometimes used in an outpatient setting. Sometimes they'll actually use these also. They will also use these in the inpatient hospital setting as well. Oxygen, supplemental oxygen, is something that's also used, but it can be dangerous to use supplemental oxygen at home because it's kind of a last resort type of thing. And if you're getting worse and worse and worse, and you come to the hospital and you've already been on oxygen, they don't have much else, other places to go. So usually supplemental oxygen will not be used unless you're in the hospital first. They may send you home with it after hospitalization, but they usually won't give that to you at home unless you've been to the hospital first. If you end up as an inpatient in a hospital, and of course if you're getting worse, you need to be contacting your healthcare provider. If you're getting really bad, go to the emergency room, obviously, but stay in contact with your healthcare provider from the beginning to the end is the best thing to do. So these are the big steps. If you're in the hospital, they're also going to put an IV in you. The IV is, again, hydration. They're keeping you hydrated with the IV. They can give you a lot of these things we've talked about, steroids, antibiotics if necessary through the IV as well. They can give you the albuterol nebulizer treatment. They can do the pulmonary toilet is what it's sometimes called, where a respiratory therapist will, after one of these nebulizer treatments, will come in and just kind of slap you on the back. You're kind of leaned over, helps you cough up this stuff, get this gunk out of your lungs. They'll do, of course, X-rays, CT scans will show sometimes this, well, will show the pneumonia if it's developing. It's a bad disease, so take care of yourself, do the best you can, and stay in contact with your healthcare provider and follow their recommendations. And ultimately, try not to get it, but if you've got it, that's what this video has been about. I hope this has been helpful, and I wish I could tell you more in a short setting, but this is a lot of information in a rather short setting. I hope you don't need it. I hope you don't have this disease, but if you get it, again, I just wish you the best. Take care of yourself. With one other thought, and that is if you're a smoker, please stop smoking. If you get the virus, definitely stop smoking. Your chances of going into that bad 20% are really high if you keep smoking when you get this disease. Also, if you're overweight, I'm not saying you go out and crash diet, but obesity, some people with obesity are not doing as well also, so really be careful, monitor yourself well. And same thing with people with other comorbidities that we talked about earlier. I wish you the best, and thank you.